Welcome to week 5 of what to expect throughout your pregnancy. In this video, you're going to learn what is happening to your baby, what is happening to you, and I'm also pregnant, so I'm going to be sharing my own journey throughout this pregnancy as well. If you are also pregnant either at the same time as me, or maybe you're watching this video in the future, feel free to comment below to let us know how you are feeling it this week, because we would love to connect with you on your journey. So what is happening with baby in week 5? So week 5, our nervous system for baby is starting to develop, as well as like the brain and the spinal cord is continuing to develop from week 4. Our circulatory system is also starting to develop. So the blood vessels are starting to form, as well as the heart is even starting to form. It first forms like a tube, and then all of the different chambers start to form. You may even be able to see a heartbeat on an ultrasound. They don't recommend that you try to listen to the heart rate, but you can see a little flicker on an ultrasound, which is kind of cool. During week 5 and really all of the first trimester, that neural tube is starting to develop. So it's really important that we're taking either a prenatal vitamin with folate or folic acid to kind of help allow that neural tube to fully form, to prevent any defects that might form like spina bifida or anencephaly. So taking a folic acid or folate supplement is really beneficial. We both took Needed, which is a prenatal vitamin that has folate in it, to kind of help decrease the risk of neural tube defects from forming. For you, you might start to feel more of those pregnancy symptoms of the fatigue, the shortness of breath, maybe a little bit of nausea, but not just yet, but like maybe the headaches or even that constipation, that slowing down from that progesterone. So you might start to feel a little bit more symptoms. And this is still, if you haven't yet called your provider to schedule your prenatal appointments, this is a great time to do that. For me, starting at week 5, I didn't have a ton of symptoms yet. Yet is the key word. So I'm still able to work out. I did get a few workouts in this week. I know that that's going to end very shortly. It's historically for me, my first trimesters have been very tiring and very nauseating. And so it's just been really hard for me to work out. So I'm trying to take advantage of it while I'm still feeling relatively good. However, I do have a super sensitive gag reflex, and this has been a trend in all of my pregnancies. So brushing my teeth usually makes me vomit, which feels very counterproductive. This is a big reason why dental care and hygiene during pregnancy is a really big deal, because you are more prone to like cavities and issues with your teeth during pregnancy. And yeah, so see your dentist. Your dentist, just side note, a lot of dental insurances will offer an extra cleaning during pregnancy for this reason, because there are risks of increased like getting cavities, and oral health is so important in decreasing things like preterm labor. So I will still be brushing my teeth, but I will also probably still be throwing up every time I do so, and do not brush your teeth after you throw up, because that's just going to increase your risk of cavities. In addition to a very sensitive gag reflex and not having tons of symptoms yet, I am feeling very nervous about this pregnancy. So I do have a history of pregnancy loss. We had 2 pregnancy losses in between our first 2 children. So it was my second and third pregnancy technically. And so I do feel just like a little bit nervous because I don't have those symptoms yet. I can't get an ultrasound yet. So I don't have any way to know that everything is okay. And so a part of me is just needing to accept this state of unknown and being okay with not being in control of this. And so what I'm choosing to do right now, which may or may not resonate with you depending on whether or not you've had losses, I know folks that have had losses don't find this approach as helpful to them at all, is I'm choosing to celebrate and be excited for this pregnancy, even though I know it may end in a pregnancy loss, because that's always a real possibility. Like 1 out of 4 pregnancies end in loss, unfortunately. But I'm choosing to be excited because in my previous pregnancy losses, I think I would have felt more sad had I not been excited for those pregnancies and instead spent the whole time really scared. And that's how I felt for my son's pregnancy. So my second term pregnancy, I was like really scared the entire time. I was super detached. And so if I had had a pregnancy loss that one, I think I would have felt even more sad because I didn't take time to bond with my baby. So even though it's still really early in my pregnancy, my baby's the size of like a peppercorn, like very tiny, I'm still choosing to be like really excited about the fact that I am pregnant and just letting go of control and hoping that things go really well. And then next week, I'm planning to get an ultrasound so I could hopefully see that something is happening to kind of ease some of my anxiety. But I am choosing to be excited as best as you can after having a pregnancy loss. And so if this is something that resonates with you, I hope that it helps you along your journey. And I'll share a little bit throughout this trimester on things that I'm doing to help me feel a little bit less anxious about the unknown of pregnancy. So thanks for tuning into week 5 of what to expect throughout your pregnancy. You learned a little bit about what's happening with your baby, what you can expect for yourself, and then I shared a little bit about what's going on with me in my own pregnancy. If you are pregnant, please comment below to let us know how you are feeling during this week. We would love to connect with you throughout your pregnancy. And it's super exciting to me when I know folks are pregnant at the same time as me, because it's really fun to be on this journey with others. Tune into our entire pregnancy what to expect series so that you can know what happens at week 4 all the way to week 40/41, depending on how long I stay pregnant.